Professor of Medicine and Associate Dean of Student Affairs in the Office of Student Diversity and Inclusion. It's my honor and pleasure to again welcome you to our anti-racism lecture series. This is our 6th installment, and they have been phenomenal to this point, and we're looking forward for this one to be equally as excellent. Our speaker tonight joins us from my home state, Pennsylvania. Malik Washington is the Director of Sexual Violence Prevention and Education at the University of Pennsylvania. As an educator, advocate, and facilitator, his work relies on engaging theories of community building and accountability, Black feminism, abolition, and restorative and transformative justice to understand and end the systems of violence. He's an advocate for youth empowerment and the agency of young people in their education and lived experiences. Malik's background is that he has a bachelor's degree from Howard University with a focus in communications, Africana studies, and political science. He is a master's candidate at the University of Pennsylvania and Graduate School of Education, and he currently lives in West Philadelphia. Malik, I am delighted to have you join us, and you came at a recommendation from one of our students whom we just adore, so we knew you had to be great as well. And I'm excited to hear you speak to us this evening on systems of violence and our urgent interventions. Malik, the floor is yours.
Thank you so much, Dr. Nesbitt. It's really a pleasure and an honor to be here this evening to speak with you all as a part of this series. So many thanks to you. And I also want to thank Ms. Greta Epps for your help in organizing, and Sandra, our beloved student. I'm so glad that you all get to have her down with you all. She was great at Penn, one of our peer educators, one of our PAVE educators, doing the really important work of prevention among students and talking specifically about what intervention means. For all of you who have joined us this evening, I'm greatly appreciative of your presence. Thank you for being a part of this. And it's a particular honor to speak to this particular community. I see somebody in the chat mention trouble hearing. So if anybody else is having trouble hearing, just let me know. It's an honor to be able to speak to this community today. This is, I think, the first time that I've spoken or given a presentation such as this to a medical school, I think, which is interesting, being that I work at an institution with a very large health system and medical school. And I think the reason that is, why that resonates with me the way that it does, is thinking about the practice of medicine as a life-giving institution. We know that there are so many barriers when it comes to healthcare and for folks getting the care that they need. But at the end of the day, and on a foundational level, I believe that many of you all, whether you are practicing, whether you are teaching, whether you are supporting in administrative roles and so forth, are participating in what we might call a life-giving practice. And that's important, and we're going to come back a little bit more to that later. On the subject of life-giving, I also want to acknowledge all of those who have participated in some way in the previous weeks that we've had, and particularly for many of you all down in Texas, and thinking about mutual aid and support of one another. And when I think about the role and the work of response in interventions in violence, it's a community effort in which we all play a different role, in which we all have something to contribute both to the prevention of violence and harm, as well as to the response. Right? And so when we come together and aid one another and support one another, we are modeling what I believe is the world that we wish to co-create with one another. As Dr. Nesbitt mentioned, in my current role, I am the director of our sexual violence prevention education at Penn. And I am a preventionist and an educator. And what that means is that I am often facilitating workshops about what violence is, about recognizing and being aware of it, about what our interventions and responses can be and how we can all be better equipped to, like I said earlier, finding our unique role within our community to both respond to violence and create a community in which it is not as prevalent or pervasive as we know it to be. I also serve as a support and advisor. So I'm often an individual who is meeting students, and not just students, including our staff and faculty and members of the community, when they have experienced violence firsthand, or they are met with a situation where somebody that they know or love has experienced violence and they're not quite sure what to do. I've served also as an advisor to individuals as they navigate various systems, whether that be our criminal legal system or the systems of investigation that we have on our universities by way of the federal Title IX regulations, which some of you may be familiar with. In that advising role, I'm advising both people who have experienced violence as well as individuals who have committed violence. And so I have been on both sides, quote unquote, both sides, for lack of a better term, of that experience and of that process. I've also participated in circle facilitation when we think about restorative justice and transformative justice processes, when we're bringing individuals together to figure out how we can find the best way forward. And all of these experiences from a practical level, as well as engaging theories of abolition and Black feminism, have come from me, have brought to me both my knowledge and perspective about what I know and believe that we need to do collectively to end violence and to create a world where it is not as prevalent or where it does not occur. I mentioned that I am an abolitionist, and what that means is that I do believe in the abolition and the end of prisons and policing. And that's not what I've come here today to focus on, and it's not my intention, or do I believe that everybody must be an abolitionist, but it does guide, I think, this work of anti-violence. And I do believe that anybody who is taking an anti-violence or even an anti-racist stance must have a critical lens of prisons and policing in our society, the role that they play and the role that they do not play. For many people, their familiarity with violence is in some way attached to the institution of policing, whether that be what we have seen over the past few years in the images of individuals who have been harmed and violently killed, or whether that be as a response, what we think we might do or what we should do or what we're supposed to do when we are in the proximity or witnessing a violent or dangerous situation. I'm often asked, how did I get involved in this work? How did I begin, or how did this come to be for me? And I think having answered that question or been in those conversations often, I have developed a very boilerplate or elevator pitch of what I would believe is a synopsis of my work in my life. And I often begin that with my work with a small organization in Washington, D.C. Called the William Calibre Foundation. The William Calibre Foundation, it's a namesake, William, who experienced one of the most atrociously violent events, which was as a young child witnessing the murder of his mother and sibling in their home by his mother's estranged boyfriend. Through my work with WKF and specifically with William, I learned a lot about violence and domestic violence. And it was in that role where on the response side, whether that was be late at night in the evening, speaking to somebody who had just lost a loved one, or it was in the circles that we had developed, community circles for young men, many of whom were adjudicated. They were in the juvenile justice system, oftentimes for committing violent acts themselves. And what I learned within that experience, which I think is consistent with the words of Danielle Serrid, who is the executive director of the Common Justice in New York City, which does restorative justice. which is nobody's entry point into violence is as a perpetrator. This has come up often in some of the trainings and workshops that I'm going to share with you all. And it was in those circles where that became true for me, that folks, young men, young boys, if you will, who had engaged in some of the most violent activities and behaviors, that they had often experienced violence in other ways, whether that was in their communities, in their schools, and oftentimes in their homes, whether they were a victim of family violence, and oftentimes that included childhood sexual abuse. And these are not often things that we think about when we consider how folks come into violence, specifically as it relates to boys and men. A lot of my work has been engaged with this idea of masculinity that has become somewhat of a topic over the last few years. When you may have heard the phrase of toxic masculinity, and particularly in its relationship to the Me Too movement, working with teenage boys, oftentimes in high schools, and young athletes, about what does it mean to be a man? What do they know about issues of domestic violence and sexual violence? And how have we, those of us who identify as men, how may we have been socialized and cultured to accept violence and participate in it in varying ways? This is something that I continue to do through my work at the University of Pennsylvania with young men on our campus who are athletes or in fraternities and so forth, seeing them both on that prevention side and, like I said earlier, oftentimes and unfortunately, after they have caused some type of harm and they're making some type of sense of it. I am an educator and a facilitator by nature. And what that means is that I am most comfortable in those spaces where we are learning from one another, in which I may ask questions and I may receive feedback, and we're building on that. I know that the format today will mostly be in the form of a lecture, and I'm happy to share my experiences. And I hope that you feel encouraged to share yourself. So if something resonates with you, any responses or thoughts or anything that may resonate with you, feel free to place that in the chat. And then we will also have time for some Q&A at the end. We're going to talk a little bit about interpersonal violence. And when I say interpersonal violence, I'm thinking specifically about what you may also call intimate partner violence. So dating and domestic violence, relationship violence, sexual violence and assault, even harassment. We sometimes use the catch-all term interpersonal violence to describe that, although it is often used as well for thinking of things about community violence or gun violence. And I always, and we always, in this learning and in this education, like to think about it across systems, right? And so these things never happen in a vacuum. They never happen in a moment. They are the product and the culmination of whether that be the socialization, the experiences and events, and what are those? And what are they across scale, from the most intimate levels, from one person to another, to larger systems, as I mentioned earlier, thinking about things like prisons or policing, or even thinking about things such as war and international conflicts. These are important things as we think about our interventions and responses, which we will continue on to think about. What are our individual responses? What are some of the things that we become aware of on our college campuses? What are some of the things that you can do in your individual and professional roles? How is violence coming to you, or you are becoming aware of it? And additionally, how are we addressing it in our personal lives? I always believe that we are most equipped to intervene on violence and harm that is closest to us. So we may be able to identify that is far away. We may be able to look at some of the headlines that came up in Me Too over the years. We may be able to look about the violence that is captured on a cell phone screen, and we absolutely should denounce that violence. But where we have the most power and the most agency is when it's closest to us, in our communities, in our workplaces. But it just so happens to be that those are also the spaces where it is the most difficult and it is the most challenging to address that violence because of the relationships that we have and the way that we exist within those spaces. But those relationships are dependent, those healthy relationships and building healthier relationships with one another and with the community are dependent on our ability to stop and intervene and respond to violence. I labeled the title of today, the urgency of our interventions, right? And what urgency means to me is distinguishing it from what I think often occurs, which is immediacy, right? Immediacy, the feeling of doing something to feel like we've done something. Urgency, rather, recognizes that we are always in an urgent moment when it comes to harm. There's rarely a moment that is more urgent than another. And we recognize that what we do today, no matter how small, is building something for our futures, along with addressing our past. That is what I mean by urgency and an impactful urgency. As it is now, I'm mostly doing this work on a college campus. And many of you have spent some time on college campuses, whether it be as a undergrad, a faculty or staff, professional students. You may also be very familiar or somewhat familiar with many of the themes that have emerged in the news and the media over the years about campus sexual assault. It was a significant thing. It continues to be a significant thing. And it particularly arose early in the Obama administration as an issue that was addressed by federal guidelines through the federal Title IX regulations that were enforcing gender equity on college campuses and educational institutions. I think with those narratives about college sexual assault arose perhaps a very slim picture about what this means and what it looks like. And so as you hear violence on campus and you hear campus sexual assault, I want you to think in your mind, who is the victim that you picture? Perhaps what do they look like? What is their experience, their background? What is their gender? I raise this because as the narrative has arisen of college sexual assault, we have to ask ourselves why. And while it is important that we have brought more attention to the issue of violence and harassment in our educational institutions, we know that it is often perhaps because of the privileged backgrounds that we might assume by somebody who has an opportunity to go to college. In other words, violence and sexual violence is incredibly pervasive. It is impacting people all across the US and all across our world. But what, of course, leads us to sympathize or pay attention to what happens on college campus as a national issue? And then who is it that we imagine? Some of the early headlines and storylines that came up often focused on institutions like the one that I'm at, the so-called elite or Ivy institutions, that we can imagine that the victim would be a young white woman who comes from a middle-class and educated background, who deserves to finish her degree, right, without the experience of sexual violence. All of things, of course, that I believe. But outside of that picture, there are so many others who are also experiencing violence who do not fit into that narrative. A couple of years ago, we participated in what was called the Aau Survey at Penn. And there was a number of institutions that are in the Association of American Universities that participated in that survey. And the idea was to get a sense of the prevalence and the rates of sexual assault on campus, as well as a number of a wealth of other information about what these experiences were. And I want to share with you a little bit about what came from this, because the information and the data that we received, I can tell you, Even if the survey was not given outside of these institutions, I can say that it's fairly consistent across the board. Some of you may be familiar with the phrase 1 in 4, which became a popularized way to simplify what was the experience of women on college campuses, that 1 in 4 women on college campuses across the country will have experienced sexual violence throughout their matriculation. In the AAU survey, both for the campus for Penn's campus, as well as other institutions that participated, were fairly consistent with that, in that it was right around that 25% of current undergraduate students shared or disclosed in the survey that they had experienced some type of sexual assault. But when we digged a little deeper, we also know that when you specifically honed in on fourth-year students, college seniors, women who are seniors, that the number was actually a bit higher, that it was actually closer to 1 in 2. In other words, 50% or almost half of undergraduate women on our college campuses by the time that they had left will have experienced some type of sexual violence. We also got a number of some quality data on stuff such as locations, right? As well as the experiences of grad and professional students, who we often leave out of the narrative when we think about the violence and harassment that is occurring on campus. We know that grad and professional students, many like yourself, who may be in the room, are experiencing violence and harassment as well. Sometimes that may come from peers. Other times it comes from staff and faculty. This is some of the information that we gained. We know that our students who are trans and gender queer are also some of the most vulnerable and experiencing some of the highest rates of violence. Some other important things that we gained from this information was how individuals dealt with violence once it was experienced. And we know that individuals are most likely to share with a friend that they had been assaulted, more than any other category, more than a campus resource, more than a staff member or faculty member, more than even family members, right? And I think that this lines up with what we know about how folks are experiencing these things. And it emphasizes to all of us the importance of our own knowledge and preparedness to deal with the experiences of violence. It is likely that somebody will tell us as a friend before they tell anybody else. And what we know is that the experience of an individual upon their first disclosure is highly determinative in terms of how they deal with it from that point forward. And so if they share with a friend that they have experienced this thing, and that friend is unsupportive, dismissive, perhaps even blaming them for what they encountered, the likelihood that they will talk to anybody else about it is much less. And this is a part of our conversation when we think about violence, not just in this small or honed in topic of sexual violence, but on a larger scale when we think about harms of racism and sexism, and how all of these things are intertwining and working with one another. The impact of violence is being worn all around us. And too often, it is only once we have experienced it ourselves or somebody close to us do we become aware or knowledgeable about all of these signs of the impact. I often say in educational settings, particularly for educators, professors, lecturers in class, folks who have had students drop off unexpectedly. You don't know what's going on. They were a fairly good student who showed up all the time, and now all of a sudden they are not there. I can tell you from my experience that what has often accompanied that sharp drop off of academic performance in attendance is sometimes an instance of violence, harassment, bias, some type of harm that we know is prevalent, too prevalent in our institutions. What I often like to do, and I've used that term violence quite frequently, is then ask, what is violence? And so I will put that question out there to you all. Say, what is violence? How would you define violence? And I want you to feel free to share and pop something, send a message in the chat, if you will. One of the frameworks, as folks are thinking about how they might define violence and what they think about when that word comes about, I often use what we call the violence pyramid, which is the work of a Norwegian sociologist, Johan Galtung, who has specifically broke violence down into a number of different, or 3 different specifically, definitions, right? And as folks are sharing in the chat, I want to thank you for your responses, and I will absolutely share that out with the rest of our group here. Some of the things that were shared in the chat: somebody feeling coerced to do something against their wishes, right? Absolutely. Aggression, right? An aggressive or threatening act to intimidate or harm another, right? These are all, I think, very valuable definitions and contributions to how we might think of violence. Oftentimes when folks hear violence, they think of what Galtung called the direct violence. This is the easily identifiable violence, right? So a punch or strike, this physical violence that you can see the impact of. That's what we often might describe as direct violence. But I would say that the definition is even larger, and that the impact is even larger than that, and it's larger than something that we can often see. That there's sometimes, perhaps, we know from folks who are in abusive situations, whether that be in relationships or so forth, and there's not often just a physical impact, that there's often a mental or an emotional, a psychological impact, a long-term impact. There's something that takes longer to recover from than the physical violence itself. I see somebody mentioned in the chat, violence can be physical or non-physical. Absolutely. Crossing boundaries without permission, right? Bodily boundaries, spatial boundaries. These are some of the things that I think that we could label or identify, define as being direct violence. But there are other components to direct violence, things that allow this violence, enable it, lift it up. And if you've ever seen perhaps a diagram of an iceberg, if you will, right? And you see that large iceberg, that tip of the iceberg that's just head is right above the water. And then to imagine that it is much larger below the surface, that the pieces that are lifting it up, enabling it, allowing it to float are that much bigger, things that we cannot always, or we do not always see. And this is what Galtung would call symbolic and cultural violence. I'm sorry, structural and cultural violence. Structural violence being the means, the structures, what are the norms functionally? And if we think about a college campus, institutionally, right, that are allowing, that make violence permissible, that even enact violence itself, okay? And then the cultural violence would be those things that are symbolic, those things that are in the cultural realm that justify or enable those structural things. So I want you to imagine and continue to imagine that pyramid, or again, that iceberg, these structural and cultural things that are lifting this up. Sometimes when I go through the violence pyramid, one of the things that I like to do, that I think all of us or many of us are familiar with, particularly my folks down in Texas, right, is the sport of football. And I know that Dr. Nesbitt is familiar with that as well. We talked a little bit, being from the Pittsburgh area, and she is from, I would say, one of the fertile grounds, right, of football in the United States. That's Aliquippa, or Quips, right? I use this game of football to talk about violence. And I asked that question, is football violent? And you can feel free to ponder that for a moment and think about that. Is football violent? And again, in that violence, we're thinking about that direct violence that we described earlier, some of the things that I mentioned, and some of which our colleagues and peers have shared in the chat. Right. Okay. And I see a few responses. I appreciate it and thank you for sharing. All right. Says that football is violent. Another said absolutely. Said aggressive, but not necessarily violent because they are governed and following a set of rules in a contact sport. And we said, no, I don't think it's violent. Okay. All right. So we've got some various responses and I appreciate those. I can share that when I've gone through this exercise in the past, one of the focuses in determining whether we believe that thing is violent or not has often come down to a question of consent, or like was shared in the chat, the rules, right? And I would say that when I think about violence, I'm thinking about the impact, right? And I think the consent element, and particularly the rules and the organized structure of it, is absolutely matters. But what I know as somebody who has watched the game for many years and who played when is growing up is that it hurts. Football hurts, it does. And it also poses, I think, a immediate physical threat to the bodies of individuals who are playing. And for those who have been, following the sport or following the news for many years, the long-term impact is that football, I think, poses a physical and mental risk, both immediate and long-term. And I would say that we could categorize that as a form of direct violence. And if you're familiar, I think with sometimes maybe the intentions, you would say, well, somebody's intention is not to hurt. And perhaps that's true, but we know that when we're playing this game, you're hitting folks as hard as you can, right? I want us to stick with that for a moment, because the next question is if we have this thing that exists so prominently in our society that poses an immediate and a long-term risk to the health and well-being of individual, the health and well-being of individuals, right? Then what are some of the things, again, that pyramid, that iceberg, that are lifting it up, that are enabling it and allowing it? And so when I go through this exercise, I talk about or ask about the structural components and the cultural components. And many folks think the structural components, we could say, is that folks love football, love to watch the game, love watching on Sundays, love Super Bowl Sunday, right? There's a lot of money to be made, a lot of money involved. There's a whole life organized around both Saturdays and Sundays, Fridays, depending what level of the game that you're watching, right? These are structural elements that enable and allow for this thing to continue, as well as the cultural elements, right? Whatever cultural investments are within that. And we talk about some of the connections between football or even the military, which became a big thing when you think about flyovers and so forth. Thinking about, what is the cultural investment into this game? And there's a little bit of both. There's a lot of that is allowing and enabling for that. And I always use this example of football, not to tell folks that they're wrong for liking or playing the sport, not to tell folks that if you want to be an anti-violence advocate or somebody who's standing up against violence in some way, that you have to abscond the game of football. What I use this example is to say that if we can imagine this thing that we know poses incredible risk to individuals, right? Then what are some other forms of harms and risks that are uplifted by our structural and cultural norms? And this is what I focus on and what we think about and talk about when we think about violence. When we think about the concept of campus violence, Seamus Khan and Jennifer Hirsch, the authors of the recent book, they're researchers at Columbia University, the book Sexual Citizens. And one of the things that they focus on in college violence is the architecture and the geography. In other words, if there's not many places for students to go on campus, and the only places to hang out or the only places to study is in a dorm, and specifically in a dorm room, and within that dorm room, the only place where you can really sit and lounge is on a bed, then what are some of the things, what are ways that that facilitates a series of boundary crossing that leads in a sexual assault? That's just one example when we think about structural or cultural violence. I want to kind of wrap this back up into identity. Is one of the things that I also sometimes turn our attention to when I talk about football. And one of the responses that we get, somebody who plays the game of football, right? And we know that we're thinking specifically about professional football. We can acknowledge that the majority of athletes playing professional football are young Black men. And how might that contribute to our concern, right, of their health and well-being, playing the game? But I just throw that in because when I think about racism and specifically violence and how folks are experiencing this, I'm brought to the quote of Ruth Wilson Gilmore, who is a abolitionist and geographer, who describes racism in the way, he says, the state-sanctioned and or extra-legal production and exploitation of group differentiated vulnerability to premature death. I'll share that once again. It says the state-sanctioned and or extra-legal production and exploitation of group differentiated vulnerability to premature death. What I always appreciate about that group differentiated vulnerability to premature death as it relates to racism, and if we expand upon that, so we're not talking about the impact of racism as though the impact of feelings, right? Or, I was excluded from this thing because of my race, which is often sometimes perhaps the narrative that emerges. You see a lot of that, particularly this month during Black History Month, all of things that are valuable and important. When we are talking about racism or the impacts of violence, we're talking about folks and their deaths. We're talking about the ways in which folks may experience a premature or an early death. And I know for many of you in the health and medical fields, this is quite relevant, and you see it firsthand, or you see it in statistics. Who is more likely to be impacted in a certain or specific way? The vulnerability to premature death, right? This is, I think, the impact. Whether or not it is somebody, an individual, or an institution's intention, here is the impact of what we're sitting and what we're dealing with. When we think about the impact of violence, racism as violence, sexism as violence, and the ways that they are intertwined or intersecting, or what, of course, Kimberly Crenshaw would call intersectionality, which was not to say a multitude of identity makes somebody more oppressed than somebody else, but rather the intersection and the multitudes of identities that make somebody vulnerable or unprotected. And on our campuses, when we think about the young women, specifically young women of color and Black women who are experiencing violence at high rates, young Black men who are experiencing violence, all of these axes that promote or allow for that vulnerability to premature death. When I think about the interventions, the preventions and interventions, we often, in our work as preventionists, we kind of break that down into something that was actually borrowed from the public health field, which is the primary, the secondary, and the tertiary, right? Primary meaning preventing or stopping something before it happens. Secondary, meaning that immediate once it's happened or it is happening, right? And then the tertiary, the long term, long after something has happened. And I bring our attention to the tertiary because it's oftentimes, counterintuitive to what we would think of as being prevention. What do you mean we can prevent something long after it's happened? And the reality is that the tertiary is where most and many of us have a role when some type of violence or harm has occurred. How we respond, again, decides whether we are normalizing or accepting a behavior in our communities or whether we are dispelling it and saying that we do not allow or we do not wish for this to exist in our community. The tertiary is important when we're thinking about sexual violence because it is that what we think should happen or what we know happens, what we believe happens in the wake of sexual assault that muddies our belief and our ability to respond. What do I mean by that? I mean, when we're thinking about carceral justice, we're thinking about prisons and policing, we know that if you accuse somebody of sexual assault or sexual violence, that is perhaps what they are facing. The reality is that it is rare for individuals to be both reported for sexual violence in contrast to how often it happens. It is rare from once it's reported for it to actually follow through and for somebody to be found responsible or guilty. And then if they are found responsible and guilty, it's even rarer when we think about the punishments that occur. But as an abolitionist, I'm not just thinking about the removal and the ending of that prisons and policing to instances of sexual, racial violence. What I'm thinking about is how that captivates our awareness and our imagination of what can be. In other words, if somebody comes to me and they say that I have had this experience, I have been harmed, I have been hurt violently, what interest do I have in determining whether that is true or false, whether that is fact or fiction? What would it mean as a community for many of us, as I mentioned earlier, life-giving institutions and roles, if when somebody tells us that they have been harmed, if our only concern was how do we repair that harm? This is one of the ways that I think that our carceral justice system has limited our ability to properly respond to instances of harm within our community. So when that comes to me, I'm immediately thinking, how can I help this individual? How can I repair this harm? And what I can tell you from many experiences and many times of sitting with those victims and survivors of violence, oftentimes not what they want is for an individual to go to jail, to be punished violently by the system. They want is oftentimes an acknowledgement that what happened occurred, an acknowledgement of their pain, their hurt. And oftentimes, they want some type of satisfaction or some type of commitment that the harm won't happen again, that somebody else will not have to experience what they have experienced. This is what I think about a life-giving response. What does it mean to meet and repair the harm that an individual has had and ensure that they can continue to grow in the healthy and productive as possible? I know we're running up against 15 minutes here, and I want to kind of, as we head into Q&A, and I do see some messages and questions, it's like, what does this mean? What is your role, right? And some questions that I would challenge you to think about and ask yourself rather is, are you sensitive to the pervasiveness of violence and its impact? And what that means is that in any time we step in a room, we can be sure that there are individuals among us who have experienced violence firsthand in some of its form. That is something that we all must know and sit with. Do you know what to say to somebody who has just shared or disclosed an experience with you? Do you know how to affirm This could be a student of yours. This could be a peer. This could be a patient, right? Are you aware of how these experiences might be impacting your interaction with them? And are you aware of resources at your institution, locally? Are you aware of the resources that are available to you and individuals who have experienced some type of harm? And these are some of the practices that we are participating, preparing ourselves to be involved with that tertiary response and that long term, so that we are renormalizing what it means to be in community with one another, in minimizing the prevalence and the impact of sexual, racial bias and violence and harm. And I'm gonna end right there and wrap up because I know we got to get to Q&A. So thank you all. I open for any questions or responses.
Thank you, Dr. Washington. That was wonderful. We have several questions that have already been asked, but before we start the question, I just want to highlight to our audience that we do have resources on our campus, folks who are standing ready to support all of our campus in different domains, particularly for our students and our residents. We have a wellness and counseling office who are very well trained and ready to offer support to all of our students. We've recently opened a bias reporting tool that is open to students, all learners, including our residents, staff, and faculty, and each reports in a different location on that website, and that is located on our Office of Institutional Equity and Access, in which they can report, and there's an impartial investigator who will investigate and then follow the appropriate lines of response for the individuals engaged. And then, of course, we have our student mistreatment portal, in which students can report, as well as our Title IX office and deputy officers who have been very responsive to anyone on our campus who, you know, reports a witnessing of an event or has been directly involved and they've been very careful to be respectful of people's wishes, but also directing them to some support services. I just wanted to point that out. And in Texas, we have some very specific rules around how that data is received and what our obligations are. And I just recommend that our audience go to that website to take a look at it more closely. I think you raised some really important issues around the concept of violence, how we view it, how we think of it. I don't know that we've always recognized the effect that violence has on our psyche and on our interactions going forward, even if you're not directly involved in it, is being in the company of other people who are violent may really, really change you a lot in how you respond. One of the questions in our chat box is what are your thoughts of Black on Black violence and its impact and messaging to the broader community as just one, and not the entire, but just one component of violence that we see.
Absolutely. Thank you for that, Dr. Nesbitt. Thank you for that question. I think that the term and the phrase Black on Black violence has lived a long and many lives. And, you know, one, I think we would question, well, what does that mean? We know that plenty of people, plenty of Black folks are being harmed by plenty of Black folks. But like most harms, that is a question or a point of proximity, right? We are most likely to harm those who we are nearby. And in our realm and here in the United States, it is still incredibly segregated, both in terms of where we live residentially and where we interact. Yes, that's what Black on Black violence means, in the same way that the majority of white people who are impacted by violence are impacted by white folks, right? That's kind of how that works. I think that has been, you know, that phrase has been weaponized often to dismiss, I think, calls against other forms of violence, specifically police violence. But, you know, I think that the existence of that thing. The fact that many Black people are being harmed by other Black folks are not a way, should not be taken as a means of distracting ourselves from other form of violence, where we can't think or consider these other violence because of this thing, but it rather, I think, drives home the point about some of the institutional failures. In other words, is that the systems that we have in place, specifically policing and prison, are not stopping this thing from happening, right? So, those are just, I think, to the simple question in what you've asked, and specifically kind of the, in quotes, in the label. That's how I would address that.
Sure. I guess, what always strikes me is that the term Black on Black violence implies that by very nature of being Black, that there is something about that makes you violent, and ignores the violence that is, really invoked on that community at large. And how much of this do you think is really a response to the lack of resources, the lack of availability to, express yourself in other ways, or more importantly, I think the lack of having a specific entity to take out your frustrations on? Recently seeing all of the police brutality, is that the police brutality, it strikes me, is not always just directed at the police, but rather it is a systematic response. And that's, kind of my thought. What are your thoughts about that?
Sure. I mean, I think that there are, so many factors that are contributing to the prevalence of violence. One of the ways in which I've interfaced with it much, I mentioned earlier, thinking about, kind of issues and concept of masculinity. And, there are, I can talk often about a masculinity that is not toxic or is not violent, but I also exist and I move in spaces that allow for a certain type of masculinity. It means that I'm not often fearful of my life, or fearful that somebody is going to physically threaten me in a certain way. And the reality is that many of our young folks do not have that privilege, right? So what does it mean to believe that you must carry yourself in a way, or in order to prevent your own self from being harmed, that you might have to harm somebody else? This is a philosophy that does not just exist on a community level. It goes, again, up to scale if we're talking about connecting systems, right? And, you have one, we think about something like perhaps, the rights to gun ownership and what that means, or even up to the level of international conflicts in the military. In a lot of ways, I think if you have this dystopian vision of what community violence, specifically within Black communities and Black neighborhoods, looks like, you can imagine that it is playing out along many of the principles principles and values that have been expelled on these rights to protect oneself, which is always kind of this proactive or unilateral behavior that I think contributes to much of the violence. And I think that's, again, one particular piece.
Sure. In our Q&A box, we have a question from one of our audience members. How can we talk about new issues like the increase in anti-Asian violence without sounding like we're trying to shift the focus from ongoing violence against Black people? I think that's a really salient question. Thank you for that.
Absolutely. Thank you for that question. I think I would always fall back when I see that happening, whether it does feel like folks are distracting or taking away, if you will, from another type of violence or the type of issue, or folks are being accused of that, which I've encountered often, is that we fall back to this idea of solidarity, right? And that it is important for us to pinpoint the unique ways in which people are experiencing or being impacted, but then always connected to the larger scope of it. And that's when I talk about, that's why I emphasize the importance of those systems. So acknowledging the rise in the danger of anti-Asian violence that has emerged in the past year, right? And connected to this larger system of white supremacist violence and how that works and how that operates. And that, yes, I mean, that it is very different and distinct from perhaps anti-Black violence, but in many ways, we are beating back against the same force, if you will. So I would always pull back on solidarity. I would think from an education or even an organizing standpoint that we're working with one another individually and across organizations so that we're aware of how our messaging is being received. We're aware of our blind spots, who we may not be thinking and who we may not be considering, or how we're not imagining what we're saying landing with certain groups, and acknowledging that we need one another to fight and push back up against this issue.
Thank you. We've got just a few minutes left, and I'll invite our audience to put your final one or two questions in our chat box or in the Q&A box so that we can tap into Malik's fountain of knowledge. But I'll ask you this one relative to our context of this conversation, and I understand you're not a clinician, but as we think of education and educational needs for people who are involved in care of patients, how do you see this conversation being useful, or what suggestions would you make to help us to be more cognizant of recognizing the effect of violence that one may have on their health or on their health needs?
Sure. You know, I would say to my best of the ability, from my knowledge of working with clinicians in a training capacity, that one is that recognizing and acknowledging violence is a health issue, right? That violence is impacting the physical and mental well-being of all of us, and particularly in a clinical setting of our patients that we're interacting with. And if we recognize this as being an important factor, like we would say any other important health factor, then we are being attuned to the ways that it may be manifesting for us. And that it means preparing ourselves to create a situation where perhaps somebody might be comfortable sharing with us that this is an experience that they had or that they're currently in, right? Because in saying that this is actually also a part of your health. And how do you present yourself as somebody that an individual can trust and share and confide with? And I think that we all have to be prepared with that in a number of ways. You know, some of our folks on campus, this is not in a clinical setting, although it is some of them, but mostly staff and faculty, we have a training, we call our anti-violence advocates training, and then we give out small things that folks can put in their office. You know, is there something that you can put in your space that just signals to somebody that this is a safe space if somebody needs to disclose that they're having this experience? And that might be the point of entry that allows for further intervention.
Yeah, I love that. Let's see if we have any other questions already in our box. I'll ask you one final question about intersectionality. Black transgender women have the highest rates of violence invoked on them. And I'm curious to hear your thoughts about addressing that. And then we had another question that popped up just as I asked. So why don't you talk about that one, then we have one more.
Okay. I see the question in the chat, and I have to say that I am not familiar with the latest bill, that Bill 127 that you're speaking of. So I don't want to speak outside of my scope or my knowledge. I could go into a whole thing about gun rights and specifically how it impacts, survivors and folks who are experiencing domestic violence. Some of the things that we know is that victims of domestic violence who live in homes where there are guns are much more likely to be killed, right? That increases the likelihood of fatality, right? Or decreases the likelihood that they will be able to leave a violent situation. Those are some kind of immediate thoughts. I don't believe that, I think it's okay for folks who want to be prepared to physically defend themselves in some ways. but it is not some, antidote at large to, I think, interpersonal violence. That is the simplest way that I would try to address some of the things that I see in your question. And I thank you for it. Dr. Nesbitt, you had asked, if you just remind me right before we got into that question, there was
I asked you about the level of violence against Black female transgender women, and how track that is, and really targeted, I will say, and your thoughts about why you think that is, and how we might be more proactive in really protecting that vulnerable population.
Sure. I think that's a really good question and important point. And I would refer back to thinking about that Gilmore quote of vulnerability to premature death, and that there are a number of identities that are allowing for that vulnerability, that unprotectedness, whether it be Black transgendered women, and specifically the race, the gender, being trans, that allows for a community, enables a community to say, well, they're not important, or their life is not important, and they cannot be protected. One of the ways that I interface with this particular issue is through the context of masculinity and gender, because of the number of these murders that are happening in the context of straight cis men murdering trans women who they have had some type of sexual involvement or interaction with, right? This idea of being quote unquote tricked or outed in some type of way. We know that a number of these murders have happened within that context. And so, I often think about what does it mean to change that particular experience or expectation of masculinity that makes somebody fear or feel that their manhood or personhood, right, is being jeopardized in a certain way, and then allows them to believe that they have a right over another person's body and they can dominate. And for the most part, their assessment or belief is true, because we know that there is very little response when these murders do occur. So that's, I think I mostly interface with that from the issues of working with young men, specifically around issues of masculinity and sexuality, right? And removing this idea of dominance and how it interplays with identity.
Right. Well, this has been a robust conversation, and I thank you for spending your evening with us and sharing your thoughts and experiences that will enrich us and help us to move forward in the direction that we are all trying to go. This is a wonderful way to end out our Black History Month. It's been a different year entirely, but we are forging on, and we're trying to become a better people, a better campus, by recognizing and understanding all of these different dynamics that create disparities, and really learn how to unravel them. And so this ends our evening. I thank you. And to our audience, you will hear more from our next month's installment of Anti-Racism Lecture Series. Good evening to everybody. Bye-bye.
Thank you.